parents, we wish for nothing more than for our child to be born healthy, but there are conditions that can develop in babies before birth. One of them is childhood glaucoma.
Well, here to tell us more is Dr. Pedro Cervantes with Charlotte Eye, Ear, Nose, and Throat Associates. Hello and welcome to the show. How are you doing today, sir?
Good. Thanks for having me.
Of course, we're glad you're here today. Okay, childhood glaucoma, it's a rare condition, correct?
Correct.
A lot of people don't even know that it exists.
Yes, glaucoma is a disease that unfortunately doesn't respect age. Most people think of glaucoma as a disease of the elderly, but it can happen at any age. There are congenital glaucoma, which we see in babies, brand new babies. They're born, can be diagnosed up to a year. We have juvenile glaucoma that can be from 3 to onward. So adult onset glaucoma, it does not respect age.
But Dr. Cervantes, what causes glaucoma? What is it?
So glaucoma is a disease that causes high pressure in the eye. This pressure in the eye damages the optic nerve, and this damage from the optic nerve is unfortunately permanent. But unfortunately, there are no symptoms.
So when is it, if there are no symptoms, when and how is it diagnosed?
So it depends. For example, in babies, there's a triad or 3 symptoms that are most common. One is tearing, a lot of blinking, and a lot of light sensitivity. And some patients might notice that the baby's eyes are a little bit bigger than average.
And so parents, I mean, these are something that parents should be looking out for. But what are some of the things, okay, when a parent doesn't see those different signs? Is it any other things that may cause it?
So a lot of times it's when they go to the pediatrician, they might notice a little bit of cloudy cornea, which is the surface that sits on top of the brown or the blue part of the eye. It can get a little bit hazy. But usually parents are the first ones that notice, and as I said, is the tearing and the blinking and the light sensitivity, which kind of prompts them, first of all, to go to the pediatrician, and then they'll usually refer to a pediatric ophthalmologist, and then they will do an evaluation under anesthesia, and they check a pressure, and that's how they kind of diagnose it, because the pressure is elevated in the eye.
So what kinds of problems or issues can this cause for these children?
So it depends at what time it's diagnosed. Unfortunately, for childhood glaucomas, the treatment is surgical, okay? And so when we do the surgery, we're basically creating an alternate pathway for this fluid to exit the eye, because when we treat it promptly, it will lower the pressure and it will give the kid good vision.
So, okay, I was about to ask you, so when you treat this thing properly, now vision is restored? They don't have any, does the pressure in the eye subside and does it hurt anymore?
So it never does hurt. That's kind of the problem. But once, in kids, it can be reversible if it's treated promptly. Once it sets in, unfortunately, there's nothing that we can do. And it's especially important in babies, because that's when the visual pathway is developed. Because from the eye to the brain, it has to have good stimulation, good vision, in order for the brain to develop these areas appropriately. So when we treat it appropriately, it can be reversible.
And again, it is rare, but it is something for parents to know and some things to look out for.
Correct.
So is it blindness, if it's not treated properly, is blindness the alternative?
Yes.
That's it?
Correct.
To learn more about childhood glaucoma, you can call Charlotte Eye, Ear, Nose, and Throat Associates. The number is there on your screen. It is 704-295-3000, 704-295-3000, or visit their website. It's goodsenses.com, goodsenses.com. Dr. Cervantes, thank you so much for being here.
Thank you.
Appreciate it.
Well, next